When people hear the word arthritis, almost everybody thinks what? Joint pain and gray hair. It goes far beyond that. In the Arthrossage class, we're actually talking about rheumatic diseases and rheumatic dysfunctions. And that includes basically anything where the autoimmune system is not getting along well with the rest of the cells in the body. So you can have things like gout or RA, rheumatoid arthritis, or fibromyalgia, or ankylosing spondylitis. So there's a lot of different things that we cover, and we go into some detail about what exactly the manifestations are and then why this is going to work to help them. Because one of the things that is the most important when you're dealing with people with rheumatic disorders, of which osteoarthritis is underneath, although it's not actually an autoimmune, most of you are aware it's a wear and tear disease. The biggest thing, and can I tell you a secret? Really? You want to know a secret? Come closer. The secret is it has nothing to do with your technique. Now, I didn't say that out loud. It has everything to do with client rapport. If you can't get somebody that's in pain to buy in on letting you work with the areas that are in pain, that everybody else that has tried to work with them has put them in more pain trying to work with them, you're never going to get anywhere. So the biggest thing that we focus on at the onset is how to create client rapport and how to keep it going throughout the session. Once we've got that established, we go into the diseases, we go into what the manifestations are, how we're going to work with them specifically, so you can explain this to the person in layman's terms, so you can use analogies, metaphors, so they get why you're doing what you're doing. And then we get into the actual protocol itself. Now, the key with the protocol is different than what we have in medical massage. In medical massage, you need to unconstrict the muscle, you need to create diffusion, and if the fascia is in the way because it's too tight, you need to address the fascia. And that all makes sense. If the muscle's constricted, there's no capillary bed opening, you can't get the waste products out, you can't get the oxygen nutrients in, things can't heal. In arthrossage, it's completely different. We're looking at the joints themselves and opening up the joints. So we're not so much working with the muscles as we are working with ligaments and tendons, get the joint capsule, getting those to relax and open up. Then we'll work with the muscles, but we'll do that through the back door. We'll do that by getting them into their parasympathetic nervous system. That's the opposite of the fight or flight. That's to relax, heal, digest. And once we start turning that on using rhythmic techniques throughout the body, the muscles start to let go, the tension across the joint starts to let go, and then we can bring mobility back to the joint. Once we bring mobility back to the joint, we work with the synovial fluid, we work with the synovial tissue inside the joint capsule, and we start getting ease with motion. And once they feel themselves having ease with motion and greater range than they've had in maybe years, now is a good time for you to talk to them about their home program. There are many subcategories of people that we work with this that don't fall into the overused it and wore it out or the older and gray. Take fibromyalgia, for example. Many people that come in with fibromyalgia have been through the ringer. I've had people on my table that have been through the Mayo Clinic 3 times. They're on the morphine analog at the highest level. They can't function. There's nothing to cut. PT only hurts. They didn't know what to do. They came in, they saw me. Within 3 weeks, we got them actually doing a home program. Within 2 months, had them actually out there walking, exercising, getting a good night's sleep, gave them their life back. And that's a quote from that particular client. You gave me my life back. Again, it doesn't get any better than that when you can be of service in that way to somebody.